teach you to be your own dietitian for the rest of your life so that you don't have to go to a dietitian ever again or never come back to us as well.
That's a great approach.
So,
There are many myths and facts, and as you had mentioned that you have done your research and everything, so I wanted to clear it out for the audience. So we have curated few myths and facts. We need your
sure.
expert advice on that. So the first thing, if you get pregnant or have your
Sure.
periods regularly, it will cure endometriosis. Is it a myth or fact?
Mm. These are two myths, so you need to split it. Number one, if you get pregnant, will it cure endometriosis, right? That's the question, right? So tell me this, if you get
Yes.
pregnant, you don't have your period for 9 months or until you're breastfeeding, right? And where the hormones required for endometriosis to grow are the hormones that are required for you to have a period. So when you start having
Yes.
your period, how does it make sense that endometriosis will not grow again?
Right.
I mean, that is the same logic that is applied otherwise as well by the medical fraternity, where if a woman is seeing extreme painful periods, symptoms of, IBS and things like that, painful bowels, this and that, they are just put on birth control, which means you are not mensurating. What you see as a bleed is just called a withdrawal bleed. You are not mensurating. So it's equal to being pregnant or in menopause, where you're not having a period. It's induced menopause. So as of now, this is the only solution for endometriosis. But given the fact that women live in such extreme amount of pain, this solution is also acceptable because it's helping women to live with a better quality of life,
Yes.
right?
Yes.
But like I said, a holistic approach is required. If you are going to think that, being on birth control pills, being pregnant, it's all the same, right? Because you're not reproducing. The hormones that are required for endometriosis to grow are the hormones that help you reproduce, which is normal in every woman. So if you're not allowed to reproduce and you're put on hormones, it's going to cause a hormonal havoc in your body and you're going to see a different set of side effects. So you need to work on holistic approaches along with medical
Yes.
treatments. Where a surgery is required, a surgery is required. There's no way out of it. But how many surgeries?
Yes.
For which a holistic approach is required.
Second thing is removing the uterus is a cure of endometriosis.
It is, uh, it is as simple as the problem is in the organ. So just remove the organ. So the problem is solved. But then you forget that there are other glands in the body that secrete hormones. It's not just the uterus, right? Or it's not just the
Yes.
ovaries. And then you forget that if the uterus is removed, a 25 or 30-year-old girl is going to be put into menopause. So what about the symptoms of menopause? Oh my God, that is a whole different topic because that thing is completely gone, ignored by the entire world. What women
Yeah.
go through during menopause is a whole different topic altogether, which I'm actually
Yes.
getting internationally certified with as we speak, actually. So that is a whole different issue that I am kind of very, very passionate about now because I'm seeing that most of my patients are put in induced menopause either through birth control pills or through a partial hysterectomy or total hysterectomy, which is like they have to deal with menopause at such a young age, right? You start
Yes.
aging, you have insulin resistance, your belly fat increases, your bone density decreases, you have brain fog, you have hot flashes, you have all sorts of shitty symptoms, and you feel like which are better, the menopause symptoms or the endo symptoms? You know what I mean?
Yeah. Okay, the third thing, medication treatment, as you mentioned, the medication is obviously contraceptive pills only. Or surgery will always
Hmm.
lower the AMS level. Is it correct or not?
I don't believe so, because if you are undergoing surgery, the disease is being
Mm,
removed, okay, which was compromising your fertility in the first place. So common sense
mm,
says that the AMH will not reduce. You need to give your body some time to heal. So post-surgically,
mm.
the AMH will definitely show up low because your body is using all its resources to recover and heal from the massive surgery that you
Yes,
underwent. So you cannot expect your AMH to show up like shooting up as soon as you're out of surgery. You need to give your body 3 to 4 months to heal, to recover, to nourish it, and then allow your AMH to come back to normal in a very, very slow and steady manner. And then again, work with holistic approaches. And if you know, post-surgically, patients are put on birth control either through injections
mm,
or through birth control pills because they
yes,
need the reproductive system to heal. They need the ovaries to heal. If it's ovulating, then it's going to cause a lot of pain and discomfort. So there is also that, which is obviously not going to show up in the AMH levels. You can't expect your fertility to be up and running as soon as you're out of surgery. It's a major surgery, so you need to give yourself 6 months to heal and work on your fertility along with fertility experts, holistic approaches, and everything else that you can do.
this was a much needed answer because the people in India, especially I'm talking about the India, because they don't go for a surgery because of this assumption that my AMH will decrease and my fertility will impact it. So
I'll
this
tell
was
you
a much
this.
needed answer.
I will tell you this.
Mm,
I speak for every surgeon, every gynecologist and laparoscopy surgeon in the whole of the country because I worked with my mentor who's also an endosurgeon. I'll tell you, I speak for the entire fraternity that every single surgeon's first priority is to save the girl's fertility and to get it to the
yes,
best possible levels. That is every surgeon's, doctors, GPs, gynecologists' first priority. So why would you think otherwise? That is my question. So stop, in
yes,
the gossip mongering and things like that and stop Googling shit for no reason. Go to PubMed, go to NIH, go to places where there is clinical research done on the topics that are interesting you. And don't say that, Arey, that aunt of mine said that this will happen if you eat this and this will happen. Can't eat papaya, can't eat shit. It's really, I would ask you to ask that aunt, are you a dietitian that you're giving me this advice? Stop looking
yeah,
up shit on YouTube and
correct.
Google. Yeah, go to the experts who know and who put years and years into all this. That is what I'll tell every endo warrior because you're just overwhelming yourself with a
Yes,
flood of information, and then you're just having anxiety attacks for no reason.
yes. I agree with your point because when I went to my doctor who has done my surgery, so I was like, I am in so much pain. I am not thinking about the conceiving or something like that. I'm not considering my future. So she was like, you are not considering, but I have to. And I'll have
Exactly.
to take care. After 5 years, you will
Yes.
come and say, "Oh, अच्छा अभी का चाहिए अभी करके दो." So how will I do? So I need to take care of that. So if you are going to a expert endometriosis surgeon, you are not going to a gynecologist, then obviously you will get some good advice. So you have to
Absolutely.
take care of yourself, you have to consider yourself, your pain and everything, and then take the advice. Okay. So the
Exactly.
fourth, yes, the fourth one, exercise, especially going to gym, can worsen or flare up endometriosis pain.
Mhm. It's true and false.
Yeah.
Because if you don't see, inflammation occurs when there is lack of physical movement. Humans are made to move, not to sit.
Hmm.
Our physical anatomy is made for us to move, and we see all chronic diseases, according to the functional medicine approach, we see all diseases because we are not functioning as humans were meant to, right? We have invented tables and chairs, but we were not supposed to be sitting so long. Okay.
Yeah.
So, yes, physical movement is crucial for managing and for helping to reduce inflammation in the body associated with endo and adeno. But when the disease progression is to such a great extent that there are multiple adhesions, there are cysts, or there are other endo growths in the body, it could be in the diaphragm, in the abdominal area, it could be anywhere where it's causing extreme amount of discomfort and pain, you might want to go slow and steady by, approaching this with, a physiotherapist, an expert, and not your next gym trainer. Yes, you need special attention of working with experts who have proper knowledge in women's health, hormones, etc., etc. And then you need to do it in a very, very slow and steady manner. But your aim should be to get to a point where you can do resistance training or strength training at least 3 to 4 times a week and have 10,000 steps per day, because that is actually a foolproof plan of disease reversal. Some gentle yoga once a week, relaxation things. So, yeah, that is what is required actually.
Yeah. So the fifth one is the very normal, and I can say everyone has this mindset. Endometriosis is just a bad period, nothing more.
I would really pray to God for that person to have the period that we have. That's all I can say.
Yeah. Okay. The seventh and the last one, endometriosis affects only the reproductive system.
Sorry, what? It affects only the reproductive
Repro-
systems. It is
yeah.
called a whole body disease for a reason.
Yes.
Okay, the maximum amount of symptoms associated with endo and adenomyosis are symptoms like digestive issues, bloating, immune
Mm.
response issues. Then you have stress response issues. Your pain tolerance is very low. You have migraines. You have skin allergies. There are so many symptoms of endometriosis which have nothing to do with the reproductive system. So whoever said that did not do their research.
Yes. For my case also, it has affected my intestine as well. So that is not a reproductive system. So
Yes.
yeah, thank you so much, Radhika. This was the curated question because this was the we wanted to clarify with you so that it will help our audience. So thank you so
Absolutely,
much.
absolutely. It's a
And thank you
pleasure.
so much for coming and joining this and matching that time duration also. You are sitting in Canada and I'm in Mumbai. So thank you so
Yeah,
much for
that's
that.
okay. Thank you for having me. It was lovely talking to you, and it was a pleasure doing what we do.
Thank you so